Good morning, everyone. Welcome. We are going to be talking about needs assessments today. This has been a topic that has come up a lot and is obviously a lot of urgency and a lot of questions around how to do needs assessments in a world that looks very different than it did even 4 or 5 months ago. For a lot of you who are starting a new process, we'll cover some questions that you probably have. And for those that are coming back to an existing needs assessment process, we'll talk about some things that you probably want to do differently. So some quick housekeeping and introductions. For those of you that are new, this is a one-way webinar. So the best way to ask questions or provide feedback is via the chat and questions sidebar there on your screen. So we'll take some breaks throughout the webinar today and answer any questions. So feel free as I'm going through the slides, if you want to add in anything in particular, feel free to do that in real time, and I'll come back to those throughout. And then this is a series of webinars that we've done covering a lot of different topics. They're all starting to sort of coalesce here. So it's fun being able to bring in content and concepts we've talked about before. If there are other topics or areas that you're interested in, or that you would find it helpful for us to do some webinars on, please let us know and provide feedback. The last piece, you'll get an email after the webinar with links to the slides, and then we'll follow up with email that'll include the webinar recording, as well as the actual slides of the presentation as well. So for those of you that are new, I'll do a quick introduction. I'm Mike Reich, CEO of DataContours. We do tools and data for largely public health professionals, mix of health systems and public health departments. We've been doing needs assessments in various ways for various systems for about 10 years now. So this is something we're pretty intimately familiar with, both kind of small scale, resource constrained needs assessments, as well as large CHNAs with health systems. So a lot of thoughts on this topic in particular, and certainly the modeling and reporting and visualization that we'll talk about throughout the presentation are things that we do every day. So today we're going to talk about needs assessments, and in particular some questions that are pretty common. So we'll seek to answer these. So providing some specific thoughts on the challenges that most folks are facing with needs assessments. So if you haven't gotten into the process yet but are looking to start it, we'll provide some thinking about things that are going to be different this time around. We'll talk about data and how you can think about data and what can be available. You think about analysis techniques. We'll provide an overview of different ways to look at the data and how you might think about it and do the quantitative analysis. And then we'll finish up thinking about kind of some big opportunities to improve needs assessments generally, and using this as an opportunity to maybe change some organizational dynamics that can limit how valuable the needs assessments can be. This is, and I guess a little bit of sort of context. I mean, we only have 35, 40 minutes to talk through this. So it's going to be fairly high level. I'm hoping after this, on each of these sections, when we talk about analysis, when we talk about data, we'll be able to go deeper into each of these in a future webinar. But if you do have specific questions coming out of each of these, please do let me know, because we can respond and provide recommendations around sources, depending on what your particular needs are, recommendations around analysis techniques, we also have other webinars that we've done, more of a deeper dive into some of the details of how you actually do some of these analyses. So we can share that content as well. Background, just before we get started, most of you I think are probably familiar with this, but there's different types of needs assessments. But really anyone who's working within a community is thinking about or doing some sort of needs assessment, and that's really just a kind of a quantification of need and what we're or what an organization is trying to work for. There's a lot of nuance within that, though. There's sort of this common concept of a need assessment, but it means a lot of different things to a lot of different people. So some of the common ones that come up are CHNAs for health systems, CHIPs, CHAWs for public health departments. A lot of CBOs and community action agencies are doing some sort of needs assessment as part of strategic planning or grant requirements. And so, it really is happening all over, which is pretty exciting. The downside is most people who've experienced a needs assessment have found it lacking in a lot of different ways. In the typical sort of frustration or criticism of a needs assessment that we hear is it's kind of a one and done process. So you go through this big effort to collect the data, do the analysis, usually taking months, if not a year, and then it gets published, somebody maybe reads it, goes through a board approval process potentially, and then it gets stuck on a shelf and it doesn't really come back to inform strategy in an ongoing way. So we've got some ideas about how you can think about it differently, but certainly right now that one and done process is not just a tragedy, but also really not suited for the times that we live in. So a quick overview of the current challenges as you're thinking about your needs assessment. What are you likely going to be running into? So the big challenge is really around data. And if you're looking at doing certainly the quantifiable part of the needs assessment relies on data from national sources, state level sources potentially. And we've been seeing over the last 4 or 5 months really unique and unprecedented social health and economic impacts. And so the sources that you typically rely on to do a needs assessment are going to be out of date at least a year, sometimes 2, depending on when the data was collected. And so if you're thinking about a needs assessment and you've done it before, you're going to have to find a very different approach this time around than what you relied on last time, because the data that reflects where we are today isn't going to be available until 2021 for most of these sources. And so much too late to have any sort of practical impact on planning. So then the question, we'll talk about a number of different options here, is what do you do instead? But key thing is everybody's going to be trying to figure this out. What do we do when we can't rely on ACS or the CDC measures or some of the health outcomes data? Another aspect of this is that things are changing really fast. So not just there's a significant amount of change, but it's happening very rapidly. And the typical needs assessment and sort of data collection methodologies focus on these measures, the social determinants or health outcomes within a community as really on kind of a decadal scale. So you get maybe small year-to-year changes, but really big movements only happen when you're looking at tens of years. And we're at a place right now where actually we're seeing significant movements within months, if not weeks. And so the data process, both for collecting, but also for sourcing and then analyzing, really isn't designed to handle the types of movement and data that we're seeing today. And the pace of the acceleration, the pace of the change is only increasing. So as we get we had been operating in a bit of a data vacuum for the last 4 or 5 months, as hard as that is to believe, and a lot of the indicators we rely on, some of the more sensitive measures are starting to catch up to the reality that we see. And we have big policy movements that are pretty dramatically changing the needs situation for millions of people. And so all of that combined, and sort of we lump this within the kind of COVID and monitoring and responding to the disease has exposed some of these really deep infrastructure and process problems with how we as organizations individually, as communities, as government agencies collect and use this kind of data. This is also a big challenge, and this is another place that the kind of one and done approach really doesn't fit and doesn't reflect the reality that we live in. Third dimension here is the scale of what we're seeing is really unprecedented. So there's the graph here, the visual is an example of unemployment claims for one of our customers. And you can see that starting in March, unemployment continued at initial unemployment claims were about 10x, peaked at about 10x what they've historically been. And that's about 5 times worse than the previous worst in the 2009 recession. So this is probably the most conceptually difficult thing to wrap your head around is a needs assessment needs to factor in, I think, the scale and think about how we respond to unprecedented and unplanned for scenarios. One of the implications of this is that there's really high uncertainty. We didn't think peaks like this were possible, and here they are. And so that's increased the amount of uncertainty that we have about the data and about what's going to happen in the future. And so the range of possibilities that we would think about in scenario planning or in our needs assessment are very different today than they were 12 months ago. And so I think there's a real opportunity in that to lean into it and to shake some things loose because we are in such unprecedented times. So the third aspect, or the fourth aspect of what's different is a needs assessment. I think today has a different set of urgent or different issues that are urgent within a community than we've seen before. And it's not that these weren't present before, but you think about Black Lives Matter and the focus that equity issues within a community has taken over the last couple of months. And there's a sense of urgency around these issues that wasn't present before. So organizations that may not have explicitly looked at equity issues or disparities within a community are interested or really being pushed to take these into account in their needs assessment and the types of analysis and planning that they do. And one of the challenges with this is this type of analysis requires data that doesn't often exist. So aggregation, suppression, and just data availability are big barriers to doing effective and comprehensive equity analysis. And until we figure out ways to get around those, we're going to be inherently limited in the types of analysis and the breadth of analysis that we can do. And so this is a really interesting one because I think it's again another opportunity to think about how we can do things differently and how we can improve the process to make sure that these types of social issues are better captured and better quantified for action. And then the last thought here, because a lot of needs assessments include some sort of qualitative analysis, community feedback, and at minimum, what you're trying to do is present the results of your needs assessment to the community and to your stakeholders, there are some practical challenges to doing that right now because of social distancing, because most offices are closed. Doing in-person gatherings and big collaborative meetings are a lot more difficult. And so thinking about alternative ways to present or gather feedback around the needs assessment or priorities within a community is a challenge, but also a really big opportunity. I think a lot of needs assessments were sort of presented at an in-person meeting maybe once, but not made more widely available other than a document put on a website. So this can be a real opportunity because so many folks are now used to tools and the internet in ways that they weren't familiar with 4 or 5 months ago. Some new opportunities to think about how you engage stakeholders more broadly around your needs assessment process and findings. So, I mean, the big takeaway from all this is, almost every aspect, if not every aspect of a community needs assessment has to be rethought. So what might that look like? And what are some ways that we can rethink that process and the details of it to one, function in today's world, but also hopefully improve upon what we know are opportunities. Okay, so let's think about data, because this is probably the biggest challenge as we think about a needs assessment. If we can't rely on data from other sources, what do we do and how do we get there? So there's a lot. Again, this could be its own day-long webinar on each of the different things we'll touch on. So we'll touch on each of these, but fully recognize that the details and how it applies to your organization in particular is where a lot of the work that needs to be done is. So again, we're hoping to provide a lot more kind of content around each of these bullet points, even on the upcoming slides. So the first thought in how to do this differently, and big picture, a lot of needs assessments have been really simplistic and focused largely on the data that was available, even if it wasn't a great fit. This whole theme, or the theme of the rest of the presentation, is going to be thinking about ways to really expand that, to make it more responsive, to make it more engaging, more focused, more relevant for the organization and the community. So the first way to do that is to say embrace estimation. If the data doesn't exist from current sources, really the only way to come up with a sense of what the state of community needs are on the ground today is to estimate it. And so there's a lot of different ways to think about how to estimate and a lot of different approaches to do estimation, but most organizations have not been doing estimation as part of their needs assessment. And so this is going to be a key thing if you're going to do a needs assessment in the next 12 months. You're going to have to come up with some estimation methodologies for what the current state of these needs are, absent actual measurement data. So the key thing that goes along with this is don't let the perfect be the enemy of the good. Estimation techniques are by definition estimations. They're not concrete. They come with error bars. And on one hand, I think a lot of organizations have shied away from using estimation or modeling because of the uncertainty that comes along with it, and because there's a lot of risk aversion. But we're in a situation right now where there's no other option. And so getting comfortable with it and getting comfortable with this concept that, especially right now, any data that's within a ballpark of sort of sanity is better than no data. And that's where estimation can be a really powerful tool of helping you calibrate and helping you get a sense of, where are we in uncharted waters. Some of the key things about estimation, again, there's a lot of detail within how do you do estimations, what are the methodologies, what are the frameworks that you can use. But one of the key things is to think about estimates as something you do much more frequently. We're used to data sourcing, and we're used to the long cycles around data, 12 months, year or even longer, as being pretty standard. Estimates give you the ability to look at data much more frequently, depending on what the inputs are, and we'll talk about some thoughts there. But if you're using inputs that are being reported much more frequently, your estimates can be revisited much more frequently. And that's really key, especially right now as things are changing week to week or month to month. Those estimates are going to be changing week to week or month to month. And that also presents its own set of challenges, but a lot of new opportunities. And then, because estimates are estimates, one of the key things is ground truthing with actuals. So finding different ways to validate the estimate accuracy, and we like doing this by comparing with actual values as they are reported, so you can true your models based on actual measurement data as it comes in. But also love this idea of using derived values. If you use your estimates to predict things like utilization, you can then use utilization information to ground truth the estimates and calibrate how far off or how close you are. And we'll talk a lot about process measures here coming up. First and foremost, this is going to be the way that you get data for your needs assessment. And even simple models in Excel are better than nothing right now, and certainly better than using data that is misrepresenting the state that we're in. And I think, to be specific in some ways, you think about ACS, or you think about BRFIS, or some of the health outcome measures or mortality figures, or what have you. They were looking great in most communities, and the trend has been downward, getting better for the last 10 years or so. And so if you look at the ACS poverty rate for a community, or the unemployment rate, or a lot of these social determinants, they look really good, and they don't reflect reality. We know unemployment, we know poverty, we know housing insecurity, food insecurity are dramatically worse today than they were 4 or 5 months ago. So using an imperfect estimation for how bad they are is going to be better than using ACS data that was the latest ACS data that is so inaccurate as to be useless for a needs assessment. So another approach and another recommendation is to use scenarios. So as you think about where we are today from a needs assessment perspective and from a planning perspective, how you use the needs assessment, what is going to happen is probably more important than what has happened. We know we're not done with COVID. We know we're not done with community impacts. In fact, we're probably just at the beginning of some really dramatic changes in the social determinants of health and the needs within a community for basic services. So as we stand today, if you're doing a needs assessment, the most important part of the process ought to be projecting forward 3 to 12 months to think about where we're likely to be and using estimates as the baseline, but then projecting out to what's the worst and what's the best case scenario. Getting stuck in kind of where we are today really isn't all that important, given it's likely to be very different in 6 to 12 months or 3 to 12 months. Beyond 12 months is probably too far. Things are changing so dramatically. Who would have said 12 months ago we'd be where we are today? So we have sort of this short to medium term horizon to plan around, and that really should be the focus. And then a lot of needs assessments particularly have focused on kind of upstream social determinants and some of these longer time horizon indicators. And now's probably a time to switch approach. Social determinants are really important, and we would argue that there are some social determinants that are more important right now than others. For example, access to food is probably more important than educational attainment in the next 3 to 6 months. And so thinking selectively about the indicators that you're using to measure or to estimate around, and being smart about what are likely to be the really impactful needs within the community is going to be key, I think, to making the needs assessment relevant. So third thought, and this one is a little controversial, collect your own data. This is something I've been interested in and pushing for a long time. Organizations that can't get the data that they need ought to go collect it. And yes, that takes resources and there's some risk associated with it. And it certainly takes expertise. But especially right now, if the data doesn't exist, go out and get it. Some data, even if it's a small sample size, is better than no data. And it's certainly better than the trend, just assuming that the trend line from the last 5 years is continuing. So it's an opportunity to think creatively as well about what are the data that really matters to you and to your needs assessment, rather than focusing your needs assessment on the data you can get. And we've worked with a lot of customers who they did their first needs assessment and it was focused on 8 to 10 indicators that were very high level, very general, both spatially and temporally, and really wasn't that relevant because they wanted to focus on what was available, not necessarily what was most useful for their organization or their community in prioritizing needs and actions. So now is an opportunity to think very differently about it. And one of the great things that has happened over the last 5 years is there are a ton of instruments and tools and examples and case studies of communities that are collecting data and not relying on these national sources for some key measures. And so there's no need to reinvent the wheel. Some of the ones that we've had experience with and think can add a lot of value, for example, would be the well-being instrument that the 100 Million Healthier Lives team put together with IHI. This is a community-level survey that's very simple to administer, but gives you, I think, a strong sense of overall direction. Are people thriving or suffering within a community, and in which particular areas? So it can be a really helpful sort of compass to guide further analysis. Obviously, from a health outcome perspective, taking some subset of the BRFIS instrument, working with health systems to collect patient data and aggregate it in such a way that it can be useful, and even just doing surveys that you come up with yourself. If you have questions or if you have indicators of need, like food access or housing access, being able to pay your rent, those are things that you can put together in SurveyMonkey and send out relatively quickly and easily. And they don't need a super heavy QA or validation process to get usable data in the absence of anything better. So there's also a lot of implications, and I said at the beginning, it was kind of a controversial thought, but I think really there's a huge amount of opportunity here. And the more that you own your own data and collect your own data, the more control you have over when it happens, the quality, sort of the relevance to you as an organization. So in my mind, the upsides of this far outweigh the downsides, and it's a lot easier to do than ever. Another thought on the types of data that you bring in, again, thinking about sort of data availability. So process measures can be a really helpful way of looking at the current state of a community or the current state of needs within a community. And usually we would say, in the before times, we would say, well, outcome measures are better, right? Because they're actually measuring the thing that you're trying to change rather than the activities that you did to change the thing. But in the absence of outcomes, let's focus on process. And in fact, they can play a really important role in this concept of truthing estimates. So the big one we would see is, or the big example, for example, would be if you're focused on food insecurity in a community and you run a food bank. Sure, you can measure food insecurity within the community, but you could also measure how many people are coming to the food bank. And that's going to be a really relevant and direct proxy for food insecurity. So setting a baseline of what does the process measure of people served look like compared to the overall outcome measure in the community, and then doing some estimation based on that, tracking it over time, can give you a really smart and comprehensive way to do a needs assessment. And as we think about sort of how you turn that into an ongoing process, those process measures are going to be more available more frequently and easier to get often than some of the community level outcome measures. Okay, let me pause there real quick and see if there are any questions or thoughts that people have. And again, feel free to type it into the chat or the questions box in the sidebar. Okay, so some thoughts about analysis techniques. First is any analysis that focuses on context is probably most helpful. And this is what most analysis is. There's some particular ways that you can think about this. We always say numbers are meaningless without context, right? If it's just a number and you don't know what it means, then it's just a number and it's hard to act on. And a lot of needs assessments assume a pretty deep subject matter expertise, and so they don't necessarily explain the context around some of the quantitative analysis. So we always encourage people, stay away from absolute numbers, find different ways to represent the quantitative such that people can sort of intuitively get how important it is or what it means. So a couple of different ways to do this. And we did we can send around the link as part of the follow-up email. We did a whole webinar just on the details of doing this kind of analysis for equity issues. So there's a lot of good content in that slide deck, which we'll link to, and the recording. But the key things are focus on how things have changed. So you're looking for contextualizing data by the rate of change, and this can be over time. So thinking about trend lines, percent changes, et cetera, within a community. So comparing it against itself, or you can think about how things have changed geographically. So looking at differences within a geographic region. How do different parts of a city compare to each other, and how has the rate of change been different within those different communities? Another good way to think about analysis is benchmarking against peers and providing comparisons to national, state, or regional values. There's more work that goes into this because you have to come up with the apples to apples comparison values for national, state, or regional. And we've done, pretty successfully a number of different times using a Z-score methodology to make sure you end up with an apples to apples comparison across indicators. But this can be really, really helpful, especially as you're measuring progress towards a goal, and not necessarily to achieving the goal, but how are we doing relative to other communities or other peers who are facing similar issues. The fourth approach would be use percentiles, ranking or categorizing your community needs through the use of percentiles can be a really helpful way of giving that relative context that pretty much everybody understands. So thinking about, we're 97th percentile compared to something, right? National, state, or an index of similar communities or something like that can be a great analysis technique and a good way to sort of provide top level numbers that you can use to measure over time and measure progress over time. And then the other analysis technique, and again, especially as we're thinking about equity and disparity issues, but comparing populations, obviously this is dependent on getting disaggregated data and having the ability to do that. But if you can, and estimates that are sometimes a good way to backfill into that population level data, but give you a sense of where those disparities amongst populations are. And again, you can present that as a relative measure rather than an absolute that helps people understand, you know, we have 1/3 this population has 1/3 the income as another population, for example. Okay. Thinking about scenarios, and we mentioned the importance of scenarios as a part of your needs assessment. Focusing in particular on how you use scenarios to think about these different outcomes. So you have uncertainty. Uncertainty is baked into the process and the world we live in, but these scenarios can give you kind of what we call guideposts to compare against later. So if you start with 3 scenarios, and we recommend sort of a worst, baseline, and best to cover the range of options, as we move through these uncertain times, you can use those scenarios to come back to and say, okay, where are we falling in reality and actuality as compared to where we thought we would be. So we've seen this really successfully, and I think a lot of people are familiar with this in COVID response, where you know, there's a lot of modeling going on and a lot of projection around what would be the worst case scenario, what would be the best case scenario, or what's the current trend. And you know, I think a lot of people have been educated about how to use scenarios in a way that's really effective, and it's been exciting to see because it can be a really helpful tool for an organization to be thinking about, you know, what to do in the future, especially when that is, you know, given today increasingly the focus of needs assessments. And another benefit is that it gives you an elegant way to weave together both outcome and process measures. So, you know, obviously your scenarios are probably going to be identifying outcome measures and where they're likely to be in some amount of time. But you can then use naturally your process measures to help you calibrate over time where you fall within those guideposts. So we've seen that be a really effective way of combining the two. So last thought, leverage frameworks. There are lots of really good frameworks out there right now for conceptualizing communities. And the big challenge that everybody has wrestled with is, okay, we now have hundreds of indicators. You know, the typical needs assessment for a health system is going to look at 100 to 200 different indicators of need across a number of different categories. And those are social determinants, those are health outcomes. And so the framework gives you a good way of making sense of hundreds of indicators, because that number in of itself really isn't, you know, if you give somebody a spreadsheet with 100 different indicators and values, most people aren't going to read through it, certainly not decision makers and people setting strategy. So frameworks are the really elegant way of combining that up into some high level categories with some rigorous evidence base and methodology behind it to make those hundreds of indicators actionable. And depending on the analysis technique that you do, one of the things we really like is rolling up and using those frameworks as also kind of an index, so that you can roll up the values underneath to come up with a quantitative measure of how you're doing. So it's not just a conceptual framework, it also becomes a quantitative framework for analysis. And a couple of the ones that we've seen recently, you know, there's been a lot of work around this, and there's sort of the typical sort of disease burden frameworks. There are also some really exciting ones that are much more holistic than just looking at chronic diseases. The Well-Being in the Nation The WIN framework is one that we have a lot of experience with and like, and it sort of comes out of some of the NCVHS work. And then one of the new ones from Rethink Health is the 7 vital conditions. And this is also, I think, a really smart way of thinking about broadly how communities are doing, and not just focusing on the disparities, not just focusing on the deficits within a community, but also focusing on the assets. So we used the 7 vital conditions as part of a needs assessment in New York City, and one of the interesting things that came out of that was the health system sort of saw not just the typical story of minority communities having worse health outcomes and being able to quantify that, but also, interestingly, using the 7 vital conditions, highlighted some assets within those minority communities that they hadn't been aware of, and they were able to funnel some of their community benefit dollars to supporting those assets, parks and access to transportation and some social opportunities. So they were able to sort of focus it more towards building assets rather than addressing deficits, or at least make that part of the community benefit story, which was really interesting and got a really positive response from the community. Again, we could spend a whole day just talking about frameworks and sort of the ups and downs and how you quantify and all that, and hope to do that here over the next month for sure. Okay, real quick. Okay, so question: if ACS, CDC aren't useful, what data sources are you using to base estimations or build scenarios from? Yeah, great question. So there are some near-term, what we call sort of more sensitive measures, and it depends on what you're trying to measure, obviously. So if you're looking at kind of the baseline need or social determinants that are determined by poverty, for example, you could build estimates for poverty based on real-time unemployment data that's coming out on a weekly basis within your community. And then that poverty estimate gives you some direct correlations with social determinants within your community. So that's one example of using more of that high frequency data as kind of an input into what the estimate would be. Another example would be, bringing utilization data from a healthcare provider to try and estimate what the current prevalence or incidence of diseases are within a community. There's a lot of interest and a lot of focus around mental health right now in particular, because it just has a much shorter time frame than some of these physical health measures. So there's been a lot of interest in using, and we've seen some good estimation methods around using things like call volume or provider utilization for mental health services as a proxy for things like mental health condition within the community, or projecting out and estimating potential suicides or substance abuse disorder over the next 12 months. So that combination of real-time indicators, largely these process measures that we've been talking about, is sort of the common baseline estimation technique. Great question, though. All right, so this is let's talk a little bit about process. So this is the usual process people think about from needs assessments or any sort of disaster planning. We used this slide a couple of weeks ago, and thinking about response and what disaster response should look like. It's a very top-down model. This is kind of the one and done. Moving forward and recognizing, the world is very different, and this doesn't work because things are changing weekly. We talked a lot about unprecedented scope and scale, no comparables. One of the things that has been, I think, frustrating for a lot of folks is things that were quote unquote fixed a month ago need fixing again. COVID outbreaks go away and then come back unpredictably, or unemployment goes away unpredictably, like we've seen in the last couple of weeks, or unemployment insurance. So, this top-down just isn't really working for the scale of change that we're seeing right now. So what might it look like differently? And this is where it gets really interesting with needs assessment. It should be an ongoing process. We really should move, and every organization should move to having a needs assessment process that can happen on a monthly basis rather than on a yearly or multi-year basis. It's required right now, and even before all of this, if you look 6 or 12 months ago, organizations that were able to sensitively assess needs within a community or focus on changes in outcome measures. I've seen this a lot with clinical care and clinical care alignment. They're able to do a better job if they do it more frequently. And so having a repeatable cycle of collecting data, of analyzing data, of doing the quantitative analysis and then presenting the results, but being able to do that very quickly is the way that everybody should be thinking about needs assessments going forward. So it's not how do we generate a report, but rather how do we create this process that we can repeat as needed. The frameworks can be a really helpful way of doing that and making it relevant. Process measures are a helpful way of getting around some of these data gaps. Collecting your own data is a really good way to support that kind of process. I really like the idea of using the current crisis to get over some of the institutional barriers around data sharing, especially around leading indicators. Health systems have a huge amount of data that's really valuable to community benefit organizations, community action agencies, folks that are actually serving these people outside of the health system. But so much of that data ends up being locked away and unavailable. So, obviously there's legal requirements and things to figure out with this, but generally it seems like a really good opportunity to break down some of those silos. So a couple of final thoughts here. Be bold, right? And this has been a constant theme. This is a crisis. We all need to step up and take some risks and take some of these challenging issues and come up with solutions. Particular around needs assessments, my assessment is most organizations are too conservative, both in what they measure and in how they do their analysis and how frequently. And there is a really high risk aversion to not wanting to be wrong, not wanting to put out an analysis that's based on data which could be argued with. And usually, I guess that's a matter of opinion, but right now, that old way of approaching a needs assessment isn't going to work. So there's no reason not to try some new approaches and break out of that sort of risk-averse approach to it. And again, we talked about ways that organizations can do this is think about data sharing, partnering. There are, even within an organization, there's a lot of concern around PII and data aggregation and HIPAA compliance. And oftentimes, people's default reaction to data sharing is just no, because they don't even want to trip up some of those issues, rather than thinking about, are we really going to run afoul of compliance issues? And for a lot of data, the answer is, there really isn't much of a PII component, or you can aggregate it to get away from some of those concerns. And then data collection, right? Be bold, go be your own primary source, go find it, go collect it, start doing some surveys, build that capacity and that knowledge. And then final thought here, prepare for the worst. I mean, unfortunately, needs assessments are going to be one of the few ways most organizations can really quantify how bad things are going to get. And they're going to get bad. The high side risk of things getting worse here in the fall is much higher, much bigger than the low side risk that we end up being better than we thought. Factor in all the things that are happening around the economic situation, around schools, childcare generally for people. COVID is not likely to get better in the fall, and it's likely to get a lot worse as the weather gets worse, and then you compound the typical flu season on top of it. So there's myriad reasons why preparing for the worst is probably the right answer. And in doing that, there's some really good scenarios, and the scenarios right now look sort of in some ways inconceivably bad, but that's the utility of them, is to norm the organization to, okay, what does a real kind of disaster pose look like? And if the poverty rate doubles potentially, how do we address that? Because that's not an inconceivable outcome in many communities. And thinking about the worst case, the worst in 6 months is different than 12 months, which is different than 24 months. Different populations are going to feel impacts at different times. We know from the previous recession in 2009, a lot of the, the most foreclosures didn't happen until 2011 because the economic impact took a long time to really ripple through the economy. So it's going to happen with different industry segments. It's going to happen with different populations who have different health risk factors. But taking a nuanced approach to when and where those worst case scenarios are going to happen is going to be really key. Couple of quick questions, and these are kind of my standard slides now. How concerned about the fall are we? Pretty concerned. You probably heard, unemployment insurance has expired from an economic perspective. That's a disaster, and will be. Stat last week was 38% of adults in the country felt they weren't able to pay rent or their mortgage. That was coming out of Bloomberg, so that's a huge number, and is only likely to get worse. And then the COVID dynamics are not looking good, and even if a vaccine becomes available in the fall or winter, it's going to take a lot longer to get it out to the community. So we're trying to norm people as much as we can to how much worse things are likely to get, and would encourage you all to begin doing the same. And that's the last slide. So happy to answer any questions. We have a few minutes left. Anybody's got any particular thoughts? I will wrap up here. We're here to help. We've done needs assessments. We do them. We have a lot of the analytic tools and specific methods and thoughts around some of these estimation techniques. So if you have particular health outcomes that you're interested in or community needs, happy to talk through, even just conceptually how you might think about doing some of the estimation or sourcing or data collection or analysis. And then, final wrap up, we'll be doing more detail here. So if there are particular areas of this, which again, recognize it was pretty general, but if there are particular areas or slides that would be helpful to do a deep dive on, would love that feedback, because that's what we're looking to do here. All right, so a couple of questions. Are your scenarios around the topics of basic needs, food, and housing in past webinars? And also, do you have a definition to share of basic needs? So yeah, two good questions. And Liz, I think you're in the North Sound region. So coming up after this, we'll be talking about some of the tools we've been developing with the North Sound folks to do some of that estimation and scenario planning. So I think we'll touch on some of that shortly here. And then there are a couple of really good definitions around basic needs. The latest one we tend to use is the 7 vital conditions. They have a couple of different ways of thinking about basic needs within basic needs for health and safety, basic needs for community belonging, et cetera. So we can send some of the resources out around that, but I think that's a good place to start. And then other questions. So what analytics tools do you use, and which do you not use or not like? Well, we build our own analytics tools, so we're a little biased, I guess. But there are, I think, a number of emerging tools for doing this kind of contextualization and comparison. So, you know, county health rankings obviously has a really good data set and some emerging tools. The 500 cities data set that CDC put out has a really nice web interface that NYU put together called the City Health Dashboard, I think. And they provide some interesting analysis tools for comparing correlations, at least amongst the cities that are represented in that data set. And then obviously, you know, folks roll their own through our SAS or SPSS. And I think that, you know, the folks at the University of Missouri CARES also have a bunch of really good tools for looking at vulnerable populations and comparing indicators of building maps. So there's a lot out there, and there's probably more that we like and don't have time to mention than otherwise. So, but if there's sort of, you know, specifics there, if you're interested in, happy to, you know, let me know. We can provide some more specific feedback. All right. Any other thoughts or questions? Okay, well, last thought or last note, we'll send out the slides and the recording. You'll get an email with the recording, and you'll get an email from me with the slides and link to the webinar recording later this afternoon or tomorrow morning. So as always, thank you so much for taking the time to join. Hope this was helpful. Any specific questions, feel free to reach out. And we'll be doing more on this topic soon here. So thank you all very much.